And welcome to Just Ask Joyce. I'm Joyce Oglesby, your family life fitness pro. Do I sound a little hoarse? Maybe just a little. Remember, the grandkids are still in town. They are wearing this Mimi to a frazzle. But we are having so much fun. We are making all kinds of memories. And they will be going back to Georgia with wonderful memories of Mimi and Papa and what's going on at the crazy house of the Oglesby household. And, of course, the Indiana grandkids will have all those memories. But I love helping these cousins just gel and, make these memories where they, when they are older, they will get together and they'll talk about these fun times. But last night at 9:30, that was a cold sprinkler. I can just tell you, it was a cold sprinkler, and they were determined to get Mimi under the sprinkler and wet all over, and they succeeded. But I gave them a good challenge. But thank you so much for joining us today. If you have followed me on Twitter, you liked me on Facebook, you already know the show lineup today. And I'm really, really excited about what's going to happen today because, it's you don't hear a lot about it, but you're beginning to hear more and more about midwives. And I love it because what did you do before we had hospitals and before we had that, that super care of the doctors and the nurses? Of course, we had midwives. Sometime had you been born long ago, you might would have been a midwife against your will. You had to know how to, boil the water and, tie the knots and cut the cords. But today we have certified midwives, and it's really becoming a very, very popular thing to have a midwife help in the delivery of a baby. And we have Carla Layne on board with us, who is an expert. And of course, we have Angela Glotzback, and she is the marketing and public relations specialist at the Floyd Memorial Hospital and Health Services. And of course, you guys have been hearing a lot of the programs that we've been bringing from Floyd Memorial right here on Just Ask Joyce, and they've been very well received. Well, this is going to be no less. I can tell you, this is going to be very interesting, and we are going to open the phone lines today, 502-571-2428, 571-CHAT. Now, if you're pregnant, are you thinking about getting pregnant? This will be something that you really want to pay attention to, but I can tell you, if you're a grandmom, and you get to sit in on the deliveries of these babies, you'll want to listen to this too. I just think it's going to be a fabulous show. And guys, you're not off the hook, because guess what? Dads and granddads are in those birthing rooms sometimes too. And more so than not these days, especially the dads. Not so much the granddads. I don't know if they have the stomach for it, do they?
They do.
Do you have some granddads come in,
We
Carla?
sure do, yes.
I think that's exciting. I just love that. But, Carla, I want to let the people know what your expertise, where it lies, and how you became a certified nursing midwife and also an advanced practice registered nurse. Those are some hefty titles you carry there.
Sure. I became a certified nurse midwife because of my own personal birth experiences. I have 4 children, and my first baby, when I was young, I was 19, so I didn't have a whole lot of education about the process, and I ended up having a C-section. So when I was pregnant with my second baby, my physician was wanting to do a repeat C-section, and that didn't feel like the right thing to do to me, so I started doing my own research and found my own nurse midwife, and got introduced to midwifery that way. And once I had that experience, I really felt that I was called by God to be a midwife, that He was really going to bless me, and that this was the path that He had chosen for me. And so I went back to school and I got my bachelor's in nursing, and a certified nurse midwife is an advanced practice registered nurse, so it's a master's degree program. And so I've been practicing for over 10 years now. And that's how I got here.
That's pretty cool. Well, one of my questions today was going to be asking you about VBAC. And so I think I just found my answer to that. But I think, we'll explain to the listening audience that maybe has never heard that term, because some people haven't, just what that entails. But, I love the idea, because I know that many people who have had C-sections, they think, oh no, I have to deliver every child via C-section
right
now. And that's not necessarily true, but Have you done many deliveries that way? And why don't you explain just, in a nutshell what VBAC,
Sure.
You kind of did just a little bit ago, but we'll let you give the real medical definition of it.
VBAC is a vaginal birth after cesarean section. You'll find that when you get a group of women together, they want to talk about their birth. Mm-hmm. Their birth experience is a very, very important part of who they are as women. So we're finding now that a lot of women have even a post-traumatic stress after having a traumatic delivery or a C-section, and they really want something more calm and to be more in control. So a VBAC, vaginal birth after C-section, is possible. The doctors in our practice where I'm at, OBGYN Associates of Southern Indiana, they're all very supportive of VBAC. Mm-hmm. I always have a physician backing me up when I have someone who's going to do a vaginal birth after they've had a C-section. And we have a really high success rate with it.
And what are some of the I guess reservations that people have about VBAC delivery?
I think it's the fear of the uterine rupture, mm-hmm. where the scar is, that mm-hmm. something's going to happen. And it can happen. If you're delivering in a hospital, there are signs and symptoms that you can pick up on fairly quickly. And we're, right down the hall from the operating room if we mm-hmm. need to be.
Mm-hmm. Well, I kind of jumped the gun because you intrigued me about this VBAC, and so I kind of got ahead of you. Maybe we should explain. And I know that many people you think midwife, and we've heard that terminology many, many times. And they even talk about midwives. I mean, it goes back to biblical times. But what exactly does a midwife do in this day and age, in the 21st century? What's the role of a midwife?
Well, there are different types of midwives. There are licensed midwives, certified midwives. They don't have a nursing educational background, and they do primarily home birth. And then there are certified nurse midwives like myself who mm-hmm. have their training in nursing and then a specialty in midwifery. Mm-hmm. So the role of the midwife is to be with the woman. Midwife means with woman. So not just during pregnancy, but from adolescence through menopause. So I have many patients in my practice that come to me for GYN care, birth control, hormone replacement therapy, bioidentical hormone replacement therapy. And as an advanced practice registered nurse, we tend to have a little bit more time on our schedules than the physicians do. So mm-hmm. we spend a lot of time with patients and really look at them from not just a medical standpoint, but from a spiritual, physical, emotional standpoint too. We're trying to look at the whole woman and what her needs are. Mm-hmm. And so during the day, I might see 5 pregnant patients, a couple of teenagers, and some menopausal women as well.
Well, you just blew my mind with all that, because I guess, when we probably, many of us are guilty of this, that, we think midwife, we just think, okay, your job is to help this baby get in the world. And that's kind of, once you've done that, your role is over. And so you're telling me that, and I knew, because I followed my daughter when she was going through. Now I can tell you, coming from Georgia, from the Atlanta area, midwifery is that how you say that?
Sure.
Midwifery.
Yes, either way.
It was a commonplace.
It's very common there.
Very common. When we came here and our youngest daughter became pregnant, we had a difficult time finding one. In fact, she didn't, because of the doctors that she was choosing at that time, they didn't have one. And so it was, and I understand that even Kentucky doesn't have one that like yourself. Now they have some that do the home births, right? That's correct.
In the Louisville area, there aren't any certified nurse midwives. I was recruited by Floyd and OBGYN Associates of Southern Indiana from Florida to start the midwifery program at Floyd. So I'm the first midwife there, and I've been there for about 1.5 years. So there aren't a lot of us around, but we're worth seeking out.
Yes, you are. Well, I remember when my daughter was talking about it, the one that's from Georgia, it was a really pleasant experience for her, because when she went in to get tested for her pregnancy, she was introduced to the midwife, and she was assigned to that midwife right then. And she just fell in love with her midwife, and she could call, and I can't remember her name. I wish I could. I want to say Anna. and I probably am right about that. But, she could call her anytime,
Sure.
night or day. It didn't matter, and so there were some benefits to having that midwife on board. Guys, 502-571-2428. If you have a question for Carla, you call now. We'll be back with more.
You're listening to Just Ask Joyce on WFIA, The Spirit.
Thank you so much for joining us today. Again, our very special guest today, if you are just joining the Just Ask Joyce program, is Carla Layne, and she is a certified
Certified nurse midwife.
You've got a couple of
Advanced
titles
practice
there.
registered nurse.
Thank you. See, that's why I need you here. She is a certified nurse midwife, and we are talking about that birthing experience through a midwife. If you have a question for Carla, we're going to open the phone lines for you, 502-571-2428. And Carla, you were just going through the notion of what midwife does. And, it's a little bit more than boiling the water and, getting the scissors and cutting that cord now, tying it off, all that good stuff that we've seen in the movies. We used to see that in the Westerns. But anyway, you were telling us how you take these people, and I was really surprised to hear that, from adolescence all the way through menopause, you provide services for women. So you become kind of, and I know that I have to be careful using this term, kind of their OBGYN in a sense. They're provider.
Mm-hmm. Right, definitely. And very passionate about women's health for the whole lifespan. I mean, adolescents going through a lot of things, transitioning from middle school to high school or high school to college, and then, the families having babies, and then after having babies, the menopausal period with, kids going off to college, and women, what they say to me is they come in the office and they sit down and they say, I'm just not myself. I just don't feel like myself. And so I help a lot of women that way too. Mm-hmm. I think one of the biggest misconceptions about midwives, from my patient's perspective, is, oh, you're seeing a midwife? Well, is she going to deliver the baby at home? And not all midwives do home births. Some do and some don't.
Well, some women feel more comfortable in the hospital environment, and
Sure.
Let's face it. I mean, we do go to the hospital to get some rest too, we like that attention.
Right.
And we like that security of knowing that, if something goes wrong, then there's, a medical staff there to aid us. But and it is a personal preference, is it
right.
not?
But there's no rest in the hospital. You got somebody coming in every 4 hours taking your vitals.
Don't we know that?
Right.
And but some people, it is a personal preference is to do that. But a lot of people now, and I hear about this. I know several people that have done this themselves, had that tub birth.
Right.
Mm-hmm. And we were talking before the show, you guys even have that available.
We do.
Floyd.
We have 2 tubs that we use for labor. Mm-hmm. We find that most women like to get out of the water when they're ready to deliver. Water is very soothing to women.
I was going to ask you, what is that? Why is it?
It just
why
relieves.
Would they choose that method?
Yeah, it relieves different pressure points. It's very soothing. It's very comforting. And Floyd Memorial, by the way, has a beautiful birthing center, and it's very home-like. It's a very home-like setting. So
I can attest to that. I experienced that with my one of my grandchildren here.
Right, great. So you had a great experience.
It was a wonderful experience.
Yeah,
it was really, really nice.
Yeah,
I think she wanted to stay, but
yeah, the nurses are experts in what they do, and there are anesthesiologists available if they want to have an epidural. And I do take care of women that decide to use pain management during labor, and that's fine too. My biggest thing is education, helping them make their decisions based on knowledge, not just, this is what my friend did and she had an epidural, so I'm going to do that. Mm-hmm. So, and again, like we were speaking about earlier, you get a group of women together, they all talk about their birth. It's a very, very important part of who women are and who they become as they get older.
Well, I know, I don't care what decade you are, when you have your first pregnancy, you can hear all kinds of stories, and you hear the best of the best stories, you hear the worst of the worst stories.
Sure.
And, so there's an unsettling feeling in your spirit about, okay, what is it going to be like for me? Mm-hmm. And this is kind of where you come in.
Mm-hmm.
And now, do you get so familiar with their bodies, with their, just the way they anticipate things, even their emotional aspects of, how they're handling their pregnancy, that you make this a little bit better transition for them?
I believe so. A lot of my patients will say having a visit with Carla is like sitting down and having a cup of tea, because we spend the majority of the time, we listen to the baby's heartbeat, we talk about things that are bothering them, but then we talk about educational things, and we're always talking about the end result, the goal of the birth. And I always ask my patients, what does your birth look like to you? And, I give them resources. They go online. They look at different types of classes. There's all kinds of classes now. There's Lamaze, Bradley, Birthing from Within. So I tell them, go do some research, figure out what seems to be the best class for you,
mm-hmm.
and then we'll work towards that together. So yeah, we get to know each other very well. My patients all have my email, so I say, email me if you have just a general question. If you have an emergency or you don't know who else to call, they have my cell phone number.
Mm-hmm.
I'm available to them 24/7. I take call for my patients, and so they always know that I'm going to be the one that delivers their baby.
Mm-hmm.
And
I'm sorry.
It's okay.
I know that my daughter, that was one of the things that she kept saying, I could always depend on my midwife.
Mm-hmm.
If I had a question, like I didn't know what was going on in my day, why I felt different today than I did yesterday, I could pick up the phone and call my midwife. We have a call. Lisa, thank you so much for calling in, sweetheart. What can we do for you? You have a question for Carla? Hi, Lisa.
Hi, I have a question.
Sure.
What would be a cause of high risk where the midwife could not deliver her?
Good question, Lisa.
Hi, Lisa. Thanks for calling.
Hi.
I would probably refer my patients to one of the physicians in the office if they were having a problem with, say, gestational diabetes that required insulin. If they had blood pressure problems, if they had coagulation problems, those are the most common reasons.
Okay. Thank you.
You're
All right.
welcome.
Anything else, Lisa?
No, thanks.
All right. Good question.
Great question.
Very cool. And, again, that would be what we were just talking about, like with my daughter, she could call her anytime. But, why do I feel differently today? Is
Right.
there something going on that's, that I need to be alerted to? My feet are swelling more profusely today than yesterday, or, I'm feeling a little faint and lighthearted. Lightheaded.
Yeah.
Lighthearted might fit it too, but lightheaded.
Yeah.
And so these are things that they would feel comfortable calling you and talking about.
I think it puts them a little bit more at
Accessibility.
ease knowing that they have that
Sure.
through phone or email. And with Lisa's question about the high risk, that's one of the best things about being in the hospital setting at Floyd and with the OBGYN practice that I'm in. I have access to physicians 24/7. They always know when I have somebody in labor. I can bounce things off of them. They can bounce things off of me. We help cover each other. So it's great to be able to have that relationship with the patient and feel comfortable turning them over to the physician because they're high risk. And my physicians are very supportive of midwifery care, and they try to continue to help the woman, with the choices that they've made. If it's a natural birth, they're very supportive of that as well.
And how many physicians do you have on board there?
We have 7 physicians, 5 OBs, and 2 that just do GYN.
All right. Guys, we're going to open the phone lines for you today. We just had a call from Lisa. Perhaps you have a question about what it entails to be a midwife. And if you're on the pregnant side of it, what are the benefits for you? 571-2428, 571-CHAT. Don't go away. We'll be back with more of Just Ask Joyce today.
WFIA, The Spirit.
My Scratch and Dent in New Albany is hosting a GE warehouse sale. They've shipped in over 15 truckloads of appliances priced up to 60% off retail. Added to the deeply discounted prices, GE's offering its largest rebate ever, up to $2,000 on select appliances. All appliances come with a GE factory warranty. Financing's available through GE Capital. Joining the sale is Twice Consignment, the Furniture and Home Decor Shop, and Juicy Butts Barbecue, whose proceeds will go to the Wounded Warriors Project. Also specials on Restonic mattresses. Sale starts Friday, June 20th at 8 a.m. and runs through Sunday. It's all happening at My Scratch and Dent, 234 Silver Street, at the corner of Silver and Main in New Albany. 812-941-5126.
Hi, this is Mark Mercurio with Wealthcare Investments. You may not be old enough to remember, but back in the day, certificates of deposits or CDs paid almost 18%. At that rate, your money would double every 4 years. Well, those days are gone. Now we call them certificates of disappointment because the interest rate is almost nothing. How would you like to get market-like returns with no risk of loss, have tax deferrals, safety, and access to your money? Well, you can, and I'm in a good position to show you how. Call 888-278-6525. That's 888-278-6525. We're available to take your call 24 hours a day. Together, we'll sit down and see if this type of plan is suitable for you. Call 888-278-6525. Remember, there's a better plan for your CD money, and I have it.
Securities offered through American Equity Investment Corporation, AEIC, member FINRA and SIPC. All other services products are offered by Wealthcare Investments and Insurance, which is not affiliated with AEIC. It's solely responsible for the product services offered.
It's a celebration of faith, family, and freedom with Louisville's very own Larnell Harris. Tuesday, July the 1st at 7 p.m. at St. Matthew's Baptist Church. Celebrate Independence Day with patriotic anthems. Tickets start at $10 and are available at Lifeway Christian Bookstore, at 10star.com, or by calling St. Matthew's Baptist Church. Larnell Harris, Tuesday, July the 1st at 7 p.m. Tickets on sale now.
Save 50% or more on everything from food and fun to weight loss and home repair on the Discount Shopping Club.
You can save on tickets to the Buckle Up Music Festival in Cincinnati, July 18th through the 20th, with 80 bands on 6 different stages, featuring Alabama, Willie Nelson, and the band Perry. Tickets are half price through the Discount Shopping Club, $65.
Go to WFIAFM.com and click on the Discount Shopping Club. That's WFIAFM.com.
This is Hugh Hewitt for the townhall.com Weekend Journal. In a fast-paced world, you want more than just facts. You want insight on the news that's shaping the world around you. Get it from Bill Bennett, Mike Gallagher, Dennis Prager, Michael Medved, and me. I'm your host each week on the townhall.com Weekend Journal. Give us an hour. We'll give you all the week's events from a perspective you can trust.
Stay informed with Town Hall Weekend Journal. Saturday evenings at 8 and Sunday afternoons at 4 on AM 900 WFIA, The Spirit. Right now, you're listening to WFIA on your FM dial. But did you know you can also hear WFIA on the AM dial? It's true. Go ahead and try it. Switch over to the AM band on your radio and tune it to 900. I'll be there waiting for you. See? WFIA is also on AM 900 with all your favorite shows and all the same times. So if you're having trouble with WFIA reception on the FM dial, try us at AM 900 and never miss a minute. Okay, you can put it back on FM now if you want. You don't have to. There is a radio station on the air right now where you can take your family and not be embarrassed. Where you can find hope when things seem the darkest. Where you can understand life's challenges and what to do about them. This is that radio station. We are WFIA The Spirit. And now we're available live online and on your mobile app at ChristianRadio.com. And the good news is we're in good company. Only stations like ours are invited in. Join us now online and on your mobile app at ChristianRadio.com. You're listening to Just Ask Joyce on WFIA The Spirit.
Thank you so much for joining me today. We're talking about midwives today, but we are talking to an expert, Carla Layne, who is a certified nurse midwife / advanced practice registered nurse. She is through the Floyd Memorial Health Services program right over in the New Albany, Indiana area. And she's rare. I'm just going to say she's a rare breed. I mean, they brought her up from Florida. She's highly credentialed. And Floyd sought her out because, they wanted to be progressive in this birthing area at their hospital. And again, if you've not visited the facility and you're looking for somewhere to birth your baby, you just found out you're pregnant, perhaps, maybe you're not happy with the facility you're going to be going to. It's never too late to change. Can I say that?
That's true.
I mean,
it's never too late.
It's never too late. And this is your experience. And no one should take it away from what it can be, which is a really, really good experience. And so, but Carla, we appreciate you talking to us about midwife duties and responsibilities today, but what we can expect from one. Now, I think, of course, Lisa was asking the question about complications during the pregnancy, but I want to take it to another level even here. But before I do that, I just want to ask you, can midwives write prescriptions?
Sure. Certified nurse midwives do have prescriptive authority in Indiana, so we write prescriptions.
That's pretty cool.
Yep.
That's pretty cool.
If I have a patient that comes in and she has a sore throat, if she has like a strep infection, I can treat that.
All right. There we go.
Birth control.
All right. We have a call. Joanna, thank you so much for calling in. You have a question for Carla?
I sure do.
All right.
What is a typical prenatal visit with you in the office? Like, what does it consist of?
Well, the initial visit is pretty long. We sit down and we talk about your history and other birth experiences if you've had them. We talk about diet and exercise. We talk about supplements. Nutrition is really, really important for pregnant women. It's important for your baby. It's important for your skin integrity when you're getting ready to deliver so that you can stretch nicely. Repeat visits are usually spent getting to know each other and talking about the type of birth that you want. Thanks for calling in, Jolana.
No problem. Thank you.
Did you have anything else? Is that good?
I have one more question.
Okay, sure.
How long do you normally let someone go post-date?
We were just talking about that off air.
We definitely let them go to 41 weeks, and then we do some additional testing. Typically, if a baby's going to come late, they come between 7 and 10 days late. So once we get to that 10th day late, which is, 41 and a half weeks, then we're thinking, baby's getting bigger, placenta's getting older, it's time for baby to come out. So that's about as far as I would take it.
Okay, sounds good. Thank you.
All right. Thank you, Joanna, for calling in. And guys, you can call in too if you have a question, 502-571-2428, 571-CHAT. Now, taking this complication during a pregnancy to the delivery table, if, you're there and I guess you're all, garbed up and ready to deliver, are you there like the whole time? Once somebody comes in for delivery, are you camp out there with them?
I sure do. If they're going to have a natural delivery and they want that one-on-one support, I do labor sit with my patients, which means I meet them at the hospital and I stay with them until they deliver, and then probably half an hour, 45 minutes after. Now, if they're going to have an epidural, they really don't need me sitting there next to them. So I might, come and visit several times and make sure that they're comfortable and that they're being taken care of the way they want to be. But yes, I stay with my patients. And even if you were bringing up the idea of a complication, if they have to go to the OR for a C-section, I go with them as well and I assist the surgeon. So my backup physicians always know when I have a patient that's in labor so that they're kind of on standby so that if I need them, they can be at the bedside within 10 minutes.
So what are actually some of maybe the techniques that you use during, because I sat with much curiosity when I watched the midwife manage my daughter, especially for our first grandchild, knew what to expect the next one. But it was fascinating to watch her actually put her hands on my daughter and up my daughter. It was like really, really fascinating to watch. So what are some of your techniques that you use?
Well, for labor progress, we do a lot of position changing, moving around, going in the tub, keeping hydrated. My patients all, drink during labor and have small snacks and things like that. For actual delivery, I encourage, like I said earlier, we talk about diet from the beginning. That's very important as far as skin integrity goes. So if you want to stretch and have a nice delivery without a tear or an episiotomy, your diet is very important. But we do other things too. We can talk about that when we come back.
And we are. Guys, believe it or not, this hour is going to be slipping away. If you have a call, 571-2428, 571-CHAT, you can talk with Carla Layne today, who's an expert in midwifery. We'll be back after this short break. Don't go away.
You're listening to Just Ask Joyce on WFIA, The Spirit.
571-2428. Hey, that's the number that you can call to talk with Carla Layne, just like Bridget did. Bridget, thank you so much for calling in, sweetie.
Oh, I have a question.
All right.
It's kind of embarrassing.
It's okay. We're friends.
Okay. Before I became a Christian, I had in my former life, I had contacted an STD.
Okay.
And I just wanted to know, how would that affect pregnancies in the future?
Mm-hmm. That's a good question, Bridget. Very good question. It's a little bit complicated to just answer that because there's lots of different STDs that you can contract. So, ladies, you need to have your men use condoms. So most of the STDs can be treated and they go away. There are some that don't go away, like herpes, syphilis, AIDS, HIV, those kind of things. So it would really depend on what the STD was. If it was chlamydia or gonorrhea, then it was treated and it's probably not there anymore. And we would test you for that again to make sure that the infection was all cleared up and it wouldn't affect your baby at all.
What if it was herpes?
Well, if it was herpes, that is something that you carry in your body all the time, the virus. So we would give you some antiviral medication starting at about 36 weeks to prevent an outbreak so that you wouldn't have an outbreak during delivery.
Okay. Is my chance my baby would actually, catch that?
It's very, very rare. We wouldn't do a vaginal delivery if you were having an outbreak in the vaginal area. We would do a C-section. It does happen, but it's really, really rare.
Okay.
Hope that's comforting, Bridget.
It
right?
is.
All right.
Thank you.
Thanks,
You're
Bridget.
so welcome.
Bye-bye.
These are the kinds of things that, we women have to think about. And I know that, we were talking about some of your techniques, too, as a midwife. And, of course, I loved how you were just comforting Bridget with that. And that's certainly some of your techniques. But in the birthing room, I know that sometimes women have difficulties with, their discomfort level. What are some of the things that you would do there, Carla?
Well, during labor, like I said, we walk around. We have a rocking chair that we sit in. We use the birthing ball. We have a peanut ball. We have a bathtub. And then during delivery, we do things like perineal massage with oil.
Does that prevent tears? Because, women do get them. And
sure. I work with the perineum and try to keep it as intact as possible. Mm-hmm. Hot compresses and the massage oil definitely helps, as well as starting the perineal massage at 36 weeks to get the tissue ready.
Mm. And, guys, 571-2428, 571-CHAT. Now, how could someone access you if they were thinking, okay, I like what Carla is saying, and I've been contemplating this either home birth or, just this midwife experience rather than, going through just an regular OBGYN. And I say regular, tongue in cheek here, but,
Sure.
knowing that you have that team, which I like that, you guys sound like a very cohesive team there at Floyd Memorial. But how could someone access you if they just wanted to kind of come and check you out?
Sure. Well, I want to clarify that I don't do home birth.
Okay.
So they would come to my office, which is OBGYN Associates of Southern Indiana, and we're right across the street from the hospital. And you can reach me at 812-945-5233, or you can email me at CLAYNERN@AOL.com. That's first initial, last name, RN@AOL.com.
You can also find Carla at floydmemorial.com/baby. She'll be under the providers tab.
That's really easy.
Nice and
Floyd
easy.
Floyd Memorial/baby.
Floydmemorial.com/baby.
/baby. Floydmemorial.com. And, that was Angela, of course, Angela Glotzback, who is, our wonderful lady who got Carla right here with us. She's the public relations gal right there at Floyd. And, of course, you've met Cindy through our show as well, Cindy Faree. And they do a great job of facilitating some people to just come and educate you about the services that Floyd Memorial provides. And, this is one that's very near and dear to all of our hearts. I love going on the baby wing and I hear the little babies. Every time, the babies are born, you hear the little music.
Right.
It's just so sweet. But, once that experience, and I always have this heart for dads in the birthing experience because, they did help create this child. Sure. And they have gone through this 9 months of, mom's moods being up and down, and they don't always know what to expect. I know that birthing classes prepare a little bit, but, not always. I mean, it's kind of I've seen some dads kind of shell-shocked a little bit.
They do get nervous because they don't know if they're doing the right thing or not, and they certainly want to comfort their partners.
Do you help in that?
I do. I give them guidance. Like if she's having back pain, I'll show them a technique of how to rub her back, and
because they do want to help.
They do.
They really do.
They do. They want to be involved, and they don't want to just sit back. Most of them don't want to just sit back and watch. They want to be, in on the action. And I actually have had some of my dads help with the delivery. So we've had, I've had several of the nurses that work at Floyd Memorial come to me, and a couple of the nurses are actually men, and their wives were delivering with me, and they gloved up and helped with the delivery of their baby, and that's a very empowering thing for the family.
Wouldn't that be cool, guys? You could glove up and help deliver that child. And, you do. I love that. I just love that because to me, that's cohesiveness of the family unit as well. But, those are some dads who really want to be the hands-on type dads in the family. And not that, not every man has a stomach for that now. We'll cut them some slack just because they don't like, the goriness of a birthing room. Right. They more like to stay at the head.
Well, these were nurses. So they're nurses at Floyd. They're RNs. So they were all about it.
They're all about it. But, some dads, hey, listen, we're not going to diminish the necessity for the ice chips and the cool cloth and just, the hugs and loves and the tenderness that moms need during this and the support. And even when her claws come out a little bit, and they do typically, no, stop them, their claws will come out, and, dads kind of know when to step back and then to move back again. But I just love that. And, I know that we're going to be going to a break. We may not get all of this in, but we'll come back and dwell on this more. But you have an annual event at Floyd Memorial that people could partake in, and maybe, and you talked about this, this term you use, preconception visit or talk. And when we come back from this break, you have a baby fair that is coming up.
We do.
At Floyd Memorial. And we'll talk about where, when, what times, and what they can expect when we get there and close out this very quick hour of Just Ask Joyce. We've been visiting with Carla Layne, who is a midwife expert on Just Ask Joyce today. Don't go away. There's more.
You're listening to Just Ask Joyce on WFIA, The Spirit.
And Jackie, we have a call from Jackie. And Jackie, we've got just a few minutes. If you can lay out your question to Carla, she'll address it.
Yes. If we would come to your office, are you going to be the one that would deliver us, or would we be to like another person on call?
I take call for my patients. So unless you're coming during my birthday week or a week in January, that's usually when I take my time off, I would be the one to deliver your baby.
Okay, great. That's wonderful.
It. All right.
Thanks.
And listen, you don't want to miss this because we have a baby fair coming up. And if you want to meet Carla face to face, and Carla, I think I know you're going to be there and you're going to be giving a presentation, but we'll let Angie do this.
Yeah, Floyd Memorial's having the baby fair next weekend. It's Saturday, June 28th from 9 to noon in the hospital's main lobby. We'll have more than 40 booths there with vendors and community resources. You'll have a chance to tour the birthing center and also attend the presentation by Carla, as well as a breastfeeding expert, a certified lactation expert. You can also meet the obstetricians, pediatricians, doulas, some women's imaging specialists that provide services at Floyd Memorial. Sign up for great prizes. We have wonderful prizes that we give away at the end of the day, and giveaways at every booth. So it's really a great chance for expecting moms to get just about anything they would need for that special day.
It's free. You don't have to register.
That's
you
right.
Just show up, and you can find out about this birthing experience with a midwife. And I know Carla will answer every question that you have. She's done wonderful today. If she hasn't strutted her expertise today, you haven't been listening. If you missed part of the show, you would like to go back and catch some of the information that Carla conveyed to us today on Just Ask Joyce. Hey, Tom gets that to me like ASAP. I put it up on my website as soon as I get it. Now, remember, I do have grandkids in town, but I will get that up for you, and it'll be accessible to you by midnight tonight, I promise. And you can, just go back and listen and replay whatever you have to, and then show up. That's next Saturday, the 28th, at Floyd Memorial right there in the southern Indiana, New Albany area. It's a beautiful facility. Make sure that, and you can't miss it because it's in the main lobby. Just head for there and you will just love it. It's a very, very nice atmosphere. But Carla, I really appreciate your setting your time aside. And I'll just tell you, I prayed away the babies today, just for God to hold them up for just a little bit. I know that, we all want them to come on time and it's always God's timeline. But,
I do have one of my physicians backing me up. So thank you, Dr. Hecker.
All right. Yeah, I was glad he didn't have to go out because I know that they're important to you.
Sure,
I mean,
absolutely.
You have an investment in these women because, you've at least seen them through their pregnancy, if not before, as we learned that, you take them from adolescence all the way through. And this hormone therapy, the bioidentical hormone therapy is very interesting too. And so, guys, we may have to have her back again down the road and talk about that because we can expend a lot of time on that, I'll assure you. So thank you so much, Angela. Carla,
thank you for having me, Joyce.
Thank you. And again, Floyd Memorial, their health care services there are phenomenal. Guys, I'll be back tomorrow, same time, same place. I'm Joyce Oglesby, your Family Life Fitness Pro, and I'm in battle for his cause.